Hi, I'm Dr. Taroni Lodog. I'm with the Pharmaca Health Advisory Team. I wanted to talk to you just a little bit about probiotics in children. You know, a lot of people don't realize that when a baby is inside their mother's womb, there's no bacteria in the GI tract. It's sterile. And when the baby is born vaginally, the way nature had intended, the baby swallows the bacteria that is in the mother's vaginal birth canal. And that is what seeds the intestines. Now, if you take probiotics that last month of pregnancy, you can help get better strains so that actually the baby is born maybe with healthier strains. But what happens to babies that are born by cesarean section? They don't pass through the birth canal, and their microflora actually becomes seeded later through the breast, through the environment, even the mother's skin as they come through from the C-section. We know that babies born by cesarean are at increased risk for certain things like allergies, cow's milk allergies, and even celiac disease. We know a growing body of evidence suggests, I guess we should say, that if the baby after C-section is given probiotics, a multiple strain that has lactobacillus and bifidobacterium for at least 6 months, you may be able to help reduce that child's risk of having these problems with allergies and celiac later on. So I strongly encourage moms to consider, especially if the baby was born by C-section, giving the infant probiotics. Now, you want to make sure you're getting a good quality probiotic, right? I mean, it's important. We're introducing sort of healthy bacteria into the baby, so we don't want to introduce something that's harmful. You can talk to the practitioners at the Pharmaca stores who can help guide you if you're going to be looking for a product for a young child. I would also just say older kids need probiotics, especially if they're getting antibiotics. If the child is sick and gets an antibiotic, you definitely want to use things like Lactobacillus reuteri or Lactobacillus rhamnosus GG. Those particular species seem to be very effective for helping reduce the diarrhea that can come secondary to antibiotic use. So, and then don't forget, another way to get probiotics in are just eating more fermented foods. Miso, you know, tempeh, kefir drinks, or just really good quality yogurt. If you want more information about probiotics, though, for you or your family, you can talk to one of the health team members at a Pharmaca store who can provide you some guidance.